Hi, my name is Jim. This is my presentation demonstration speech for oral communications class. My demonstration will be on the use of an EpiPen. So you might ask yourself why you would need an EpiPen. So it's used for allergic reactions more on the severe nature than minor. Initially, you'll try to use Benadryl or Claritin, something like that. But if it gets to the point where it gets worse, then that's where the EpiPen will come in. Signs of severe anaphylaxis is going to be low blood pressure, your pulse is going to be low, your respiration is going to be hard to breathe, you can have hives, you'll be cold, and then it's caused by an allergen entering your body. It don't have to be instantaneous, it could be within 2 to 24 hours. Anytime in that time span is when it will happen. So once it gets to that stage, then you'll look to use the EpiPen. The EpiPen we use it in the hospital, but it's mainly used for lay people at home that can't get to an ambulance or can't get to the hospital in time. It's when you'll use this. The medicine works. How it works is once it enters the body, it's epinephrine, which is going to hit that alpha and beta receptors in your body, which is going to cause an increase in the heart rate. It's going to cause your blood pressure to increase, and it's going to cause your airways to vasoconstrict, which is going to open and let you breathe better. So, but the use of the EpiPen is simple. Usually it comes in a package of 2 and a trainer. This is the trainer episode, or the trainer pen. You can see the bottom here is where the needle will come out. It is a pretty big needle. And then here's the top. That's how you would reset it. And then, so what you would do is once you start experiencing the signs and symptoms, if you can't, of course you want to try Benadryl first, but if you're already to that stage where you're having problems breathing, then you'll want to use your EpiPen. And when you get the EpiPen out, you'll pop the lid off, pop the other lid off, and then you'll take it and you'll smash it right into your leg or into your glutes. The needle's so big, and there's at least 3 milliliters of fluid in here, so it has to go into a larger muscle. So I wouldn't use the arms or anything like that, but I would use the thigh or the butt. Then you inject it, pull it out, dispose of it. Now you're going to feel frantic, but sooner or later it should start working, or at least until the time of the illness gets there. This can be used also for severe asthmatic attack, though it's not a preferred drug for that. For that, it's going to be more of like a rescue inhaler or breathing treatment, something like that. But it can be used, last case, for if you can't get a hold of that, and then you would use an EpiPen. It mimics some of the same actions that stuff will do, but for life-threatening anaphylaxis, the EpiPen is going to be the quickest and safest way to reverse them effects. Now, the cost of them, they're pretty expensive if your insurance doesn't cover. But hopefully the insurance does cover. Otherwise, it is pretty expensive. And there's been battles with the government on how to lower the cost. Contraindications to using this, there's not many, because really if you've got to the point of using a pen, it's life over limb. And so you want to go ahead and use it. But now it could cause you to have chest pain. You're going to have palpitations, but that's just the epinephrine. Your body already has epinephrine or adrenaline in it. It's just going to increase it. And that's all for my presentation.